The Trump administration rolling back federal funding that was originally given during the COVID-19 pandemic, and it's impacting local health departments.
That includes Sullivan County. The health department there says it is losing over $2 million in grants, and that loss will negatively impact projects the department had planned.
News Channel 11's Karen Jenkins spoke with Sullivan County health leaders to see what effect the change in Washington will have locally. Karen?
Yes, Sullivan County leaders say they were notified by the Tennessee Department of Health that as of last Tuesday, the funding was ending. And while they say the whole county will feel the impact, those in Bristol in particular could be the most affected. Of its $10 million annual budget, the Sullivan County Regional Health Department just found out it's losing $2.1 million immediately. Director Gary Mays says it's part of cuts to federal funding, rolling back grants from the COVID era.
We could not just spend those dollars haphazardly on anything other than COVID response or preparedness and emergency, and that is exactly what we did with those dollars. We just augmented as much as we could EMS or our public health infrastructure to support those efforts.
After the pandemic, Mays says the funding has continued to go towards public health efforts, but now the county will need to cut items that were to be funded with that grant money. Things like a vaccine campaign, EMS radios, electronic health records, new exam tables, and more. One of the most significant cuts will be in Bristol, where a new facility like this one in Kingsport was planned. It would serve those who may not be able to drive to the main Blunteville office. But Mays doesn't know if it's completely off the table.
And we need to work together with the community and the city of Bristol and continue exploring what we can do to get health department operation in Bristol.
Because the county chose not to use the grant money for additional staff, Mays says he's thankful no jobs will be lost due to the cuts. And they'll meet with the county commission soon to discuss ways to try and make up the funding.
We have no choice but to look at other grant opportunities or other funding opportunities. It doesn't mean that the need goes away. We just have to figure out a way to pay for it.
Now, I've reached out to other health departments in the area to see if they've had funding cuts, and I'm still waiting to hear back from them. But in an email from the State Department of Health, a spokesperson said, quote, as the federal government continues to cut waste and enhance efficiency, we are confident these changes will not impact our ability to serve Tennesseans, end quote.